Hi, and welcome back. This is Learning Health and Fitness channel, and here are 10 important body signs you shouldn't ignore. Your physical body. You only have one, and it must serve you for the rest of your life. No pressure, huh? Your body has a way of telling you when it's happy, when it's sad, or when it desperately needs your help. And there are certain signs that, if you see them, it means you should look into it. And some of these will surprise you. Make sure to ask about it the next time you see your doctor. Isn't it better to be safe than sorry? Before we begin, be sure to subscribe and activate the notification bell to keep up with all of our latest health and fitness videos. Number 1. Pink feet. Even if you use one of those handy skin creams to pamper yourself, your feet are usually the same color as your body. Lotion can soften and comfort your feet, but it should not change their color. Examine your feet the next time you're barefoot. Do they appear to be pink? Is the skin wrinkled and thin? Are they truly hard and painful? If this is the case, you should consider getting a blood test to check your blood sugar levels. Foot discoloration and distress can indicate a metabolic issue such as diabetes. Which physician should you consult? Your blood sugar and hormone levels will be checked by an endocrinologist. Number 2. Uncomfortable hugs. Who doesn't enjoy a good hug? Being tied up or crushed, on the other hand, isn't much fun unless you're really into it. Have you ever been hugged and felt like you were being squeezed unusually tight? Tighter than they're actually trying to hug you? Or did you get the impression that they were tying you up around the waist, body, or legs with ropes and chains? If this happens to you, it could be a sign of multiple sclerosis or MS, a disease that causes unpleasant sensations in your arms and legs as if you're wearing invisible gloves or shoes. The sensation may be merely irritating or extremely painful, but you should still pay attention to it. Which physician should you consult? A neurosurgeon. Multiple sclerosis is a nerve disease that should be treated as soon as possible. Number 3. Thinning eyebrows. Thin eyebrows have been particularly fashionable in some cultures throughout history. While some prefer big, bushy brows, plucking and styling your brows can really make a bold fashion statement. However, if you notice your brows becoming naturally thinner without the assistance of your tweezers, you should consult a doctor. This could be one of the signs of hypothyroidism, a condition that causes fatigue, constipation, depression, and weight gain. If you're pregnant, hypothyroidism can be especially dangerous, leading to developmental delays and potential birth defects. Which physician should you consult? Your thyroid hormone balance will be tested by an endocrinologist. Number 4. Swollen toes. We return to the feet, which can reveal a lot about our bodies. Examine your feet. If you have fat or swollen toes, or if a few of your toes resemble sausages, consult your doctor. This symptom could indicate psoriatic arthritis, which can cause skin damage and pain. Which physician should you consult? A dermatologist and/or rheumatologist can diagnose the condition and prescribe medication to treat the symptoms, allowing you to get back on your feet quickly. Fun fact: toes may appear to be an evolutionary leftover that we no longer require, but they are unlikely to disappear anytime soon. When you walk or run, even your pinky toe helps you maintain your balance. We'd only lose our toes if they actively threatened our survival. Evolution does not simply discard inconvenient or useless items. Nobody would ever get appendicitis if it did. Number 5. Loss of appetite. Even when we're dieting, we all need to eat. Do you want to lose a few pounds? A loss of appetite may appear to be a blessing, but it may be the opposite. If you suddenly lose your appetite while also losing weight, this could be a sign of metabolic disorder. This could be genetic or the result of a long period of inadequate nutrition. If you have acid reflux, you may have gastroesophageal reflux disease, which causes stomach acid to rise back up through your esophagus. That's a tube that connects to your mouth and stomach, causing pain and a bad taste in your mouth. Yuck! Which physician should you consult? A gastroenterologist is a doctor who specializes in nutrition and the effects of food, or the lack thereof, on your body. Are you going on a diet? Consult a licensed nutritionist and your doctor before and during food restriction regimen. Number 6. Itchy skin. We all get itchy from time to time, and it feels great to scratch it. It may be one of the most satisfying sensations you'll ever experience. However, if you have a persistently itchy skin that just won't let up, that could be a problem. In fact, it could be a sign of diabetes. Relax. Before you panic, consider some other explanations. Itchy spots are often caused by insect bites or mild allergic reactions to a new lotion or low-quality fabric. If none of these possibilities explain the itch, however, ask your doctor for an examination. Which doctor should you see? An endocrinologist can test your blood sugar levels to screen for diabetes. Did you know scratching an itch doesn't actually get rid of it? All it does is distract the brain from the itching sensation with a new feeling, the satisfaction from a scratch. Number 7. You hate being inside. Perhaps you simply enjoy being outside, but if you're one of those people who always asks for the windows to be opened in public transportation, have trouble breathing indoors, or feel claustrophobic at work without a window open, you should have your heart checked to rule out the possibility of cardiac failure. Because hypothyroidism can cause this type of thing, your thyroid may also need to be tested. If you constantly feel stuffy, you may be suffering from heat intolerance, a condition in which your body fails to regulate heat properly. This can be caused by medication, excessive caffeine consumption, thyroid issues, or another condition such as MS. Which doctor should you see? Consult a cardiologist first to have your heart checked, then an endocrinologist to have your thyroid checked. If neither of these yields any results, consider your doctor to rule out any other possibilities. Number 8. You easily feel cold. This is the polar opposite of indoor intolerance. If you can't stand open windows or are cold even in the summer, you should have your thyroid checked. Your body may be lacking in iodine, which can lead to hypothyroidism. Cold intolerance can also be caused by anemia or a lack of iron in the diet, fibromyalgia, or vasoconstriction. Which doctor should you see? An endocrinologist can examine your thyroid. Consult your primary care physician about other possible causes. Number 9. Sudden onset of kleptomania. Whoa there, Robin Hood! A sudden lack of understanding of the law and the desire to steal something small, even if you can easily pay for it, may be the first sign of dementia, especially if you've always been a law-abiding citizen. Unfortunately, dementia and other similar conditions can be very subtle, and it can be very difficult to admit that there is a problem, let alone ask for assistance. Keep a close eye on yourself and your relatives, especially the elderly. People suffering from dementia may be unaware that they have it, and they require our assistance in getting it treated. Which physician should you consult? Consult with a variety of behavioral experts because the problem could be physical or psychological. Make an appointment with a neurologist to check for signs of dementia, and then see a therapist or psychiatrist to learn some cognitive behavioral techniques to deal with sudden urges to steal. If the doctors do detect the onset of dementia, follow their advice to lessen its impact. Make sure to ask for assistance even if you believe you do not require it. And finally, number 10. Changes in your nails. It's those feet again, warning us of impending danger, but this time, your hands might be useful as well. If you notice your nails changing shape, such as becoming thicker and wider, this could be an indication of lung and heart problems. This condition, known as nail clubbing, is not a disease. Rather, it's a symptom of a pathological process in your body that can be caused by a variety of diseases, most notably those of the lungs or heart, but also of the intestines, liver, or thyroid. Which physician should you consult? Consult a cardiologist for a complete physical examination and follow up with your primary care physician to rule out any other potential causes. Nail clubbing is not normal and may indicate serious problems. Here's some fun trivia. Hippocrates, the father of medicine, is widely credited with being the first to identify and document nail clubbing as a sign of underlying disease nearly 2,500 years ago. As a result, the condition is sometimes referred to as Hippocratic fingers. You must be thrilled. Do you have any other unusual changes in your body that indicate an underlying health condition? Tell us about it in the comments. And don't forget to like, share, and subscribe for more fitness and health advice.